Question 1. A nurse is assessing a 75-year-old patient with heart failure. Which assessment finding would indicate that the patient is experiencing left-sided heart failure? A jugular vein, distension. B. Peripheral edema. C. Hepatomegaly. D. Crackles in the lungs. Answer: D. Crackles in the lungs. Rationale: crackles in the lungs are indicative of pulmonary congestion, which is a hallmark of left-sided heart failure. Left-sided heart failure results in a backup of blood into the pulmonary circulation, leading to fluid accumulation in the lungs. Jugular vein distension, peripheral edema, and hepatomegaly are more commonly associated with right-sided heart failure. Question 2. A nurse is caring for a patient who is postoperative. Day 1 after a total hip replacement. What is the priority nursing intervention to prevent complications? Encouraging high-protein meals. Administering pain medication. C. Initiating early ambulation. Monitoring for signs of infection. Answer: C. Initiating early ambulation. Rationale: early ambulation is crucial in the postoperative period to prevent complications such as deep vein thrombosis, DVT, pulmonary embolism, and pneumonia. While administering pain medication, encouraging high-protein meals, and monitoring for infection are also important, early ambulation has the highest priority to promote circulation and prevent immobility-related complications. Question 3. A 28-year-old female patient presents with severe abdominal pain, fever, and a positive rebound tenderness test. Which condition is most likely indicated by these symptoms? Cholecystitis B, pancreatitis C, appendicitis. D. Gastritis. Answer: C. Appendicitis. Rationale: rebound. Tenderness, fever, and severe abdominal pain are classic signs of appendicitis. Cholecystitis, inflammation of the gallbladder, and pancreatitis, inflammation of the pancreas, can also cause abdominal pain but have different clinical presentations and locations of pain. Gastritis typically presents with epigastric pain and does not usually cause rebound tenderness. Question 4. Question: a patient with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy. What is the most important reason to avoid administering high concentrations of oxygen to this patient? A. It can cause oxygen toxicity. B. It can depress the respiratory drive. C. It can increase the risk of infection. D. It can lead to a decrease in hemoglobin levels. Answer: B. It can depress the respiratory drive. Rationale: patients with COPD often rely on a hypoxic drive to breathe. High concentrations of oxygen can suppress this drive, leading to hypoventilation and an increase in carbon dioxide levels, hypercapnia, which can be life-threatening. Oxygen toxicity and infections are possible but less immediate concerns, and oxygen therapy does not directly affect hemoglobin levels. Question 5. A 45-year-old patient with a history of type 2 diabetes mellitus is admitted with a blood glucose level of 600 mg/dL. Which clinical manifestation would the nurse expect to find in this patient? A polyphagia B, Kussmaul respirations. C. Diaphoresis. D. Weight gain. Answer: B. Kussmaul respirations. Rationale: Kussmaul respirations are deep, rapid breathing patterns often associated with metabolic acidosis, which occurs in diabetic ketoacidosis, DKA. This compensatory mechanism helps to reduce the acidity of the blood by blowing off carbon dioxide. Polyphagia and weight gain are chronic symptoms of diabetes, while diaphoresis is more common in hypoglycemia,